Right, you're still watching TVC Breakfast. Now, we promised you a very packed show, and that's what we're delivering. Now, colorectal cancer is one of the most common cancers worldwide. Yet, experts say it's also one of the most preventable and treatable when detected early. However, many people are still diagnosed at an advanced stage, often because early symptoms are overlooked or mistaken for less serious digestive conditions, delaying timely medical attention. Joining us for this conversation this morning to discuss this and the importance of colorectal cancer. Ladies and gentlemen, please let's welcome CEO Niola Cancer Care Foundation, Eniola Akintunde. Good morning. How are you doing?
Good morning.
Thanks for joining us on the show this morning. Now, when we talk about colorectal cancer, people will be like, oh, they've never heard about it before, because it's not really a common cancer like that, but it's one that can be treatable, when someone has it, but early detection is also very important. When we talk about some of the symptoms, we see blood and stool, persistent changes in bowel, and also unexpected weight loss, also fatigue and weakness, and then feeling that the bowels are not empty completely. So these are some of the symptoms that we see. But before we even go into this, I want you to break it down for me, for people watching that have never heard about colorectal cancer, before.
Thank you so much, and thank you for having me this morning. Yeah, our organization is Niola Cancer Care Foundation, okay. And then the first colorectal cancer NGO in West Africa. So before 2012, I've never heard about colon cancer myself. So after 2013, when my husband was diagnosed of colorectal cancer, it was so strange. In fact, to pronounce it, I couldn't pronounce it very well. Because of course, I've heard about breast cancer, cervical cancer. And then we were told he had colon cancer with all the normal symptoms. In fact, we were treating malaria, typhoid, and all that. Then they told us it's colon cancer. And he did all the surgery and everything. But it came back again. And at that point, I thought we were dealing with normal disease, that after taking the chemo, antibiotics, it will be fine. But lo and behold, this cancer came back. Then I gave up on Nigerian healthcare. I believe when I take him to India, it will be fine. So we took him to India, we raised money, fundraising and all that. But unfortunately, he didn't make it. He died in India. Yeah, but I learned some lesson in taking him to India, as at that time in 2013, with what we have now in awareness and management of cancer, then communications with our patient. In India, the doctors knew he's not going to make it, and no information was hidden from me. They were so open with their communication. They were real, despite the fact they collected all the money we took to India. India was a medical tourism, and they needed to take money. They knew the patient is not going to make it, but they are going to take all the money. But what I learned in that was that there was communication, which I did not get in Nigeria. In fact, in Nigeria, they told us it was stage 2, going to stage 3. But when we got to India, it was already far gone. It was a late-stage disease. So there was no point for me taking him out of Nigeria. If I was told that, see, your husband, yes, you love him, but this is the situation, he cannot make it, we wouldn't have spent all that money. Then at every point that my husband was losing it in India, they were telling me what is happening to his body, which was not happening in Nigeria. And the communication in Nigeria, they will not tell you, the doctors will not tell you. But now it has changed compared to...
I just wanted to say that as well.
It has really changed. Doctors now are open. And I wouldn't blame them. The culture and tradition plays a huge role. Then the religious aspect of it. Nigerians don't talk about death. So that also affected the communication between the relationship and communication between patients and their caregiver or their doctors. So as an NGO, as an foundation, after I lost him, and with my journey in life, lost a child in a year before I lost my husband, I was like, and then when people came, they were like, colon, what is colon? So I was like, okay, let's start something. And that is where we are today. And to the glory of God, the awareness, people now, at least, I could say over 20 or 40 million Nigerians are aware of colon cancer. We are over 200. There's still a long way to go. We take the information everywhere. We take it to communities. We encourage people. We tell them the symptoms. And also, the symptoms, I'm speaking from the human angle. On the board of Niola Cancer Care Foundation, we have a co-founder who is Dr. Adedakbo Shinowo. He's a gastroenterologist and he's in Lut. He's part of the NGO. He would have been here, but you know how it is, the workload
That's right.
with our...
Yeah, but okay, but maybe you should ask her. You said this is colorectal, so is it the same thing? Because you've been saying colon, so
yes.
It's the same thing?
Yes,
okay,
most times, because the colon is the large intestine that runs through to the rectum.
Okay.
So they are related.
Yeah,
So they are related,
but not the same thing.
But not the same thing. There's
That's
rectum
what I wanted to
cancer
know.
and there's colon cancer. But we find out that most people that has rectum cancer normally comes to the NGO too. And because the colon and the rectum, they are very close.
Yeah, closer. The end part of the large intestine.
Yes, the large intestine.
See, what you have taken on is a huge responsibility.
Thank you, sir.
Because I believe what you're trying to promote is the communication of it.
Yeah.
Yes, and if we have good information, then we can take better decisions.
Yes.
That's what you're driving at. And it's not cheap to do that in Nigeria. It is not. Mass education, I mean, my colleagues are tired of hearing me talk about mass education on everything.
Exactly.
You know, because
That's the way to go.
I realize that 50% of the problems we have in Nigeria is ignorance, is because we do not know. And we have institutions that should have made us know, but they have not been very successful in doing that. Now, I would like you to run through the symptoms again, because some of the symptoms we are reeled out are also symptoms for other ailments.
Yeah.
So how would I know that low bowel movement, for example, is caused by
unexpected weight loss as well?
colorectal?
It could be.
It could be.
It could be.
It
All
could
right.
be.
So please just help us run through it again, and let us know which and which is not specific to the topic at hand.
Okay. For colorectal cancer, for it to even get to the stage of classifying it and diagnosing it that it is colon cancer, if your stool is pencil-like, that means there's a growth. There's obstruction that is causing your stool to be pencil-like. So that needs to be checked out. Then also, we educate Nigerians now that you don't need to rush into the toilet, do your major, your poo-poo, and you run out. No, look at your poo-poo. If it's changing color, dark color, and you've not eaten vegetable consistently, and your stool is been dark for about 3 months, 4 months, 6 months, you need to check it out.
Without using blood tonic.
Yeah. Then another mix that's even doctor globally, not only in Nigeria, you see doctors, patients treating ulcer hemorrhoids for some time, but they will think it's hemorrhoid or pie. At the end of the day, it's colon cancer. And unfortunately, they pick it at advanced stage. These are some of the symptoms my late husband had. But we thought it's one of those things. Then also, I remember I had dental issue too. So when yes, it is linked to colorectal cancer.
Dent, your teeth?
Yes, your teeth. Our teeth is powerful. That's why you don't just dip anything into your mouth and your teeth.
Please explain.
Yeah, I remember my late husband had dental issues for about 3 years. He had a very bad toothache, and we were trying to extract that tooth, but the doctor said we should leave it. You know, the way it is, just take about it. It's still there. It's not yet time to extract it. But I remember he had that. And later, with the latest research and study, if you Google it, dental issues are linked to colorectal cancer.
If it's persistent.
Yes.
Right. So talking about, because of our time, these are issues that a whole lot of Nigerians are going through. Some are saying that give me money, whatever is wrong with me, I'll be fine. But it is way deeper than that. You've mentioned the changes in bowel movements, blood in the stool, which most people experience, you know, especially those of us who have sedentary lifestyle, not sedentary, but then our job requires that we are sitting while we are driving, we are sitting when we get back home, not much time to walk, to exercise and all of that, and they feel because of this, the pressure on the bowel, that's why you're having difficulty in your bowel movement. And the fact that fatigue is also inclusive. He has asked, you know, all of the symptoms. She also read them out. Where do we now go for, you know, this screening to detect that whatever is wrong with you, stool in the bowel is a problem. It's something that you have to, it's beyond hemorrhoid rather, because pregnant women too also experience, you know, hemorrhoid. Where exactly should people go to to get screened? And are this screening, covered by HMOs, or are they free? Then so much so when you discover that you need to start treating something so that you don't get to stage 2, 3, or 5, which is the deadliest.
Thank you so much for that question. And yes, sedentary lifestyle that you mentioned has a lot to do with some symptoms, part of symptoms from colon cancer. And I can see you guys have been sitting for 30 minutes. Maybe you can stand up.
We'll stand up actually. We'll stand up immediately after this interview.
We'll stand up.
We do that all the time.
So please,
Right.
so you can, so that's good if you do
Right,
that every
right.
time. Sedentary lifetime, sitting on your laptop for a long time also are some of the causes of colon cancer.
Colon cancer.
Then for screening, like in our NGO, when we get funding, and major grants that we get is from a particular organization in US, the Global Colon Cancer, which is GCCA. They support us, and we take the screening. So when you call us, when you talk to us as an NGO, we can guide you through. We work with limited resources. Unfortunately, Nigeria is a country that people don't really donate. People rather support, I'll mention a particular program like Big Brother Nigeria, where they showcase all nakedness, and that is what Nigerians are supporting.
We can also say they showcase all nakedness too as well. Let's be mindful with our words.
So,
Yes.
Okay, please, I take that back.
Yeah.
But really, there should be focus on health care. All over the world globally, you don't leave healthcare management to individuals alone, even organizations alone. It's something that all of us should come together and do. Government alone can't even do cancer management and control. Everyone has a role to play. So you can call us as an NGO. We will direct you on how you can get a subsidized colonoscopy in some of the institutions that we have, maybe in Lutz. Then we partner with OUTH, Ogun State. They have an endoscopy suite where you can do your colonoscopy. Then for FOBT is also another test. The FOBT cannot really pick it, but at least it can tell you that there's something is happening in your bowel. What is FOBT? FOBT is fecal occult blood test, which shows that there's
Something in your
there's
stool.
blood in your stool. Naked eye can see it, but that test will pick it. And that is a pointer for you to go for that test.
Yeah.
As an NGO, we are a work in progress. We are talking to Nigeria to help support us so that we can also build a screening center.
Yeah. But how is funding like for you,
Funding-
How has it been like for you?
Funding is tough, I won't lie to you. I've been on it from unofficially, is 12 years. Unofficially, Niola Cancer Care Foundation is 10 years.
Oh, wow.
Yes, we are 10 years this year, and it's been tough. As I've said, the only stable grant we get is from a particular organization in US, Global Colon Cancer. Then from friends, from very close friends, from individual, there was a time Zenith Bank and a few other banks, Providus and other, they've supported
Sorry,
us.
because of our time, people want to, reach out. How can they, get to,
I'll drop our number. They can follow us at Niola Cancer Care Foundation on Instagram, Facebook, Twitter. They can reach out to us there.
Okay.
So those are the things we did. The funding. And also, before I started Niola Cancer Care Foundation, I'm a gemstone designer. I source stone within Nigeria and outside the country. So I have a strong business, which I design jewelry. I source stones with what I'm wearing. This is Nigerian stone in silver.
Amazing.
Okay.
Amazing, yeah. So I use the business to also fund the NGO, apart from the support from friends.
Well done with what you're doing at Niola. Fantastic. We can wish you all the best. May God continue to give you the strength. And, you're a very strong woman, if I do say so.
Thank you.
All right. Coming up, we will check and ask if a tougher military approach can help turn the tide against banditry and terrorism. Join us just after the break. We'll be right back.